Good morning everyone. Good morning to all my students. They are year 5 medical students, MBBS students from University Kuala Lumpur, Royal College of Medicine, Perak. And good morning to my patient.
Good morning.
Madam Kopi. She is a sister working before in the government service as the sister of the word. Now she is coming as patient because she has very good multinodular goiter with secondary toxic change, 10 years already. So she has already given to me the history. Now I'm going to show you how I'm going to do examination. For this, similarly, just now, regarding breast examination as well, I have to repeat that. So when you are going to deal with the patient, assume the patient like your own relatives. And go approach them with smiling face, friendly manner, humbly down to earth. They will never scold you, they will love you. After that, show your sincerity and friendly manner and deal with them. Okay? So, but once you are going to examine the patient already, another 3 steps to take care of. That's me, observe privacy, be with the chaperone, and then next one? Yes, appropriate and adequate exposure. For the thyroid, just little bit cooling down should be okay. Huh? So this another 3 importance. Another 6 importance, especially when you are in OSCE room, that's mean objective structures, clinical examination. 6 steps. First, step 1 is introduce yourself, greet the patient, explanation, get the consent, reassurance, finally thanks to the patient. Okay, that's all. Now let us now. I have already inquired so many times with Madam Kopi, Sister Kopi. Now she's still working in our University Kuala Lumpur Royal College of Medicine, Perak, under Prof. Esther, doing a lot of this psychiatric researches, clinical researches. She's helping there. She's very happy to be there as well. Now, for this swelling, she has been having this since the age of 20. Now she's 69 years old. So how many years now? Already 49 years she's carrying this. But in between, it never give problem for her. Okay, what are the problems that can give rise from this multinodular goiter? Okay, Alia, what sort of the problem?
Heart problem.
Yes, think about all these CVS, CNS, complications, that means toxic changes. Okay, Wong, any other conditions? Yes, compression signs. Those are difficulty in swallowing if it is too big, difficulty in breathing, pressure on the recurrent laryngeal nerve, hoarseness of voice, weakness of voice. Okay, other than that, what she had got already, secondary toxic goiter. That means all sorts of the CNS changes, CVS changes, something like that. These are the complications. Any more complications? Okay, Jasmine, you are sitting. No, you are farting. Okay, okay. Huh?
Cosmetic changes.
Pardon?
For cosmetic changes,
Or for cosmetic reason, the disfiguring. So sometimes patient may ask for removal just for cosmetic reason. Okay, done.
anxious.
Pardon? Anxious. Okay, that's me part of the toxic changes as well. Could there be malignant change from the primary? Yes, there could be. So when you are examining, what you want to exclude? If you suspect malignant change, how will it look like, this swelling? Going to be hard, fixed, all the compression signs will be there, as well as all the other secondaries, just now, like breast case, liver lung, bone brain. Especially for the papillary carcinoma, lymph nodes enlargement, for the follicular carcinoma, a little bit elderly, secondaries in the liver lung, bone brain, especially bone secondaries. Bone secondaries, what they enlarge, especially on the scalp. It looks like very angry looking, even we can see the pulsatile. Okay, so liver lung, bone brain, and CNS, just now I explained about that, cancer breast already. Okay, with this, big enough, if she is your mom, what suggestion you would like to do, Hadi?
Total thyroidectomy.
Yeah, being a he wants to be a surgeon. So he would like to suggest, okay, mom, please undergo total thyroidectomy so that there will be no recurrence because of her age. And then she didn't bother about cosmetic reason. So since 10, 12 years ago, she has appearance of the toxic changes. That means she has the secondary toxic factor. So primary toxic means Graves' disease. Okay, from the very beginning, along with the swelling, toxic symptoms are there. So being primary one, they are more of CVS or CNS. What's the problem? And secondary one, there are two, CVS and CNS. Being secondary, what are the problems? CNS or CVS?
CVS.
Okay, CVS, never mind. That's me, palpitation up to 90, first degree, 90 to 11 pass rate, second degree or moderate, and above 110 is severe type of the toxic factor. Okay, so secondary, primary, and then we know already. From there, if there is some malignancy, papillary lymph nodes enlargement, follicular bone growth, bone spread, medullary, quite rare, and anaplastic carcinoma, anaplasia, not that rare. Last few months ago, I have seen 82-year-old lady, nursing home patient, came with anaplastic carcinoma. Within 2.5 months, she passed away. Too huge. Even it was written not to attempt tracheostomy even with compression sign if the patient even cannot breathe. But our surgeons here, lucky enough, they did on the smaller side of the left side. They approached, although there is a lot of bleeding, successfully done tracheostomy, so that at least the patient can live for another 2 more weeks with better quality of life. Okay, that is anaplastic carcinoma. Other cancers are possibly like just now papillary, follicular, medullary, anaplastic, apart from that, secondarily spread from other primaries and other tissues, maybe soft tissue and lymphoma. There are lymphatic tissues as well. So lymphoma also quite common for the malignant cancer. Okay, another one is the classification. I'm not going to go into detail now. More important thing for us is to do examination of the thyroid. Okay, from the very beginning, we are going to look at from the front. You raise a little bit. Okay, good enough. By now, I'm going to see during the inspection. What do you see? Which side is bigger?
Right.
Okay, right side is bigger. There are few engorged veins on top as well, isn't it? Okay, Sister Gopi, please swallow your saliva. Okay, done. Okay, now what you see is more prominently going up. Right side is up, you see, left side separated already. And bringing down. Okay, now next step. You please raise up a little bit, open your mouth all along. Open your mouth all along. Put out the tongue and in. Open all along. Put out the tongue. No, don't close the mouth. Open all along. Put out the tongue. Put back. Put out. Put back. There we don't see any movement. That's means we are going to exclude thyroglossal cyst along the thyroglossal tract. Okay, now this is inspection. Now I'm going to test. Okay, Madam Gopi, I'm going to test whether your thyroid is heavy retrosternal extension or not. I'm going to press here. Okay, swallow. No retrosternal extension. It doesn't go down. This is one side. Another side, I'm going to percuss here. This is not so sure yet, but still, there is no retrosternal extension by percussion. And here, when we press, if the thyroid is too big, we have to feel the trachea, whether trachea is compressed or not, or pushed from one side to another or not. Okay? For that, if it is too huge mass pressing, trachea may be compressed, thin down. We call it scabbard trachea. Or, what you can do is now, before palpation even, I can test coccus test. I will push with the bigger size here to the other side. Can you breathe well? No stridor at all. If there is stridor, this coccus test is positive. Okay, now I'm going to go to behind. Now I'm going to palpate. By that time, pull up the mandible a little bit up. I'm going to palpate. So accordingly, side location is front of the neck. More on the right side. Smaller on the left side. Okay, tilang lagi. Now I can feel better. But thyroid tissues overall not so equal. Some area a little bit firm, some are soft, little bit cystic. That's why I assume this case as multinodular goiter. So the size is about 5/7 on the right, and then about 2 to 3 on the left, something like that. So at the same time, after palpation, it's still freely mobile, up and down to the side as well, not attached to the skin, and deeper as well, no attachment. Okay, here I would like to test. Okay, Madame Gopi, you push my hand forward, asking this protruding, and then, okay, still mobile. Push to the right with your chin. I'm testing all the movement of still mobile. This way, okay, push my hand up. Okay, push my hand back. Different movements. Now I'm testing muscle movement along with that, any fixity or not, something like that. Done already. Now I'm going to palpate for the lymph nodes. Submental, submandible, and then preauricular, postauricular, occipital. These are not that important. Now I'm going to pay more attention to the two triangles of the neck, anterior triangle, posterior triangle, cervical change, and deeper. Now I'm going to palpate for these. No lymph nodes are palpable, so I don't suspect. No compression sign, no lymph nodes enlargement. So my impression, it may not be malignant. No? Okay, apart from that now, after lymph nodes examination, there are few more signs. Okay, one, can you tell me any other sign? I would like to exclude malignant condition. Never mind, very sign. That's me, I'm going to palpate because I'm paying attention more to the bigger size. What am I feeling for? Carotid pulse. Now there is carotid pulse on the right side. If there is absent, it could be malignant because this tuber mass pressing on the common carotid common sheath inside already pressed. So there may be no carotid pulsation. That is very sign. Okay, on the left side as well. Okay, still very. This side is much better. Bounding already. Okay. Madame Gopi, raise your arm this way. By that time, wait and look for. Okay, raise for some time. That's mean if there is retrosternal extension, with that, the retrosternal extended, thyroid tissue may compress and there may be congestion of the face. That is called Pemberton sign. Okay, can bring down. Good. Another sign, because she is the secondary toxic goiter, not primary. But if this in primary toxic goiter, can take off the glass for a while. What are we going to test for? Primary toxic goiter? Yeah, eye signs. Lid leg, you change something like that because I'm not going to show here. Lid retraction and exophthalmos. These are the signs you have to look for. As well as the pulse rate may be very fast. Just now I told you 90, 90 to 110. Above 110. Now for a quite normal. Okay, now show this way. I have to put one paper. Anybody give me one paper? Okay. Yes. There's a tremor sign. Not so, just very mild. Everybody have a little bit. So there is no prominent tremor. Can you put on your tongue? Tongue as well, no tremor. Okay? Enough. Sister Gopi, can you sleep very well at night?
Yes.
Okay, she can sleep very well. How about your mentality? That's me, are you easily get angry and so on?
Little bit.
So, okay, by now, how much of the tablet are you taking?
Only one tablet, 5 milligrams.
5 milligram Umacazole, that is maintenance dose. No, one tablet, that's enough already. That's why she's very happy with that. Okay. Now, until now, you are living 69 years old. Are you happy with your life?
Yes, very
With your job?
Yes, very
With your family?
Yes.
With your children?
Yeah, grandchildren.
Ah, grandchildren. Oh, how many?
6 grandchildren.
Oh, 6 grandchildren already. Wow! Looks like Angelina Jolie, 6 children. I will explain to you from the press later on. Okay, very good. Now I'm not going to examine further than that. I'm very happy now. Okay, do you have any questions to ask me?
Okay, I'm okay.
Okay, now she gave me permission already. We can upload to YouTube. No problem. So this is for the benefit of other students. They can learn, they can watch this program. Okay? Okay, thank you very much. You can sit down, it's alright. Wait. Now I want to ask, okay, Elia, do you have any questions to ask until now? Wong? Okay, Fatin? Jasmine? Okay, Tan? Fatima? Is it? Fatima and Hadi? Shafiq? My cameraman. So all of you, you don't have the questions. Okay, very good. We can stop here now.